take care about all ages, but especially children. About 70% of our patients are children. And you know, otitis media, pharyngitis, tonsillitis are the most common diseases we face here in our hospital, as any hospital in the world. So these are the most kinds of diseases we face here. And the surgeries are correlated to these diseases. I mean, the tonsillectomy, adenoidectomy, septoplasty, yes, these are the most common cases.
Thank you. And second, I'd like to ask you the cases or the difficult cases that you meet for through names.
Yes, there are a lot of complicated cases, like chronic otitis media, for example, and cholesteatoma when you see it in children. So you need a lot of procedures like CT scan and its difficulties about children, and like the difficult surgeries like mastoidectomy or to interrupt, and you need the help of neurosurgery sometimes, and a lot of hard cases. Also in the nose, sometimes we need what's called FESS, functional sinus surgery, functional endoscopic sinus surgery. These kind of surgeries are very complicated also. And sometimes we face tumors and cancers, especially in the old ages. These are the most complicated cases. There's a lot of.
All right. Thank you very much, Doctor. And sometimes we saw that some people complain about ear problem. Sometimes the ear, gets some infections, and sometimes maybe gets bad infection inside of the ear. So what can we establish or can we bring for these problems about the ear?
You mean advices or tips for the people? Yes. Don't take any medication from the pharmacy without consulting a doctor, ENT. Because today I saw a case which is started with simple otitis media and then developed to cholesteatoma and bad smell. It's a dangerous sign. Bad smell from the ear, vertigo, severe pain, high fever. All of these are dangerous signs. So you have to stop it before you reach this stage. So when you see your child suffer from any pain or fever, or directly go to the doctor. Don't take any medication from the pharmacy. Even foreign bodies, sometimes they bring the children to us suffering from foreign bodies, and you notice that the pharmacist tried to extract it, and the result was a disaster, real disaster. So this is my advice.
All right. How about the cases of throat?
The cases of throat here, most of them are the sore throat and the hoarseness, the voice. So here we make something called indirect laryngoscope, and we see the vocal cords, and we can establish the right diagnosis by our devices here. But also the hoarseness is very dangerous sign, especially in adults above 40 years. Because it could reflect cancer. So you have to go when you feel hoarseness or hypertrophy in the lymph nodes in the neck. You have to go directly to the doctor.